Welcome to the Explore Global Health podcast. I'm Dr. Rob Murphy, Executive Director of the Havey Institute for Global Health here at Northwestern University Feinberg School of Medicine. We're recording in Washington, D.C. at the annual meeting of the Consortium of Universities for Global Health, or CUGH. We are diving into the topic of building systems that are strong, adaptable, and prepared for the changes that may arise in the future of global health. I'm honored to be joined today by Dr. Jarbas Barbosa da Silva, Jr., National of Brazil and Director of the Pan-American Health Organization, also referred to as PAHO. He is leading efforts across the Americas to strengthen the health systems and is speaking here at CUGH on building resilience in an increasingly complex global health landscape. Welcome to the podcast.
Thank you. Thank you for inviting me to be here.
You're speaking here about building resilient health systems in a complex global landscape. What makes that landscape more complex today than it was even 5 or 10 years ago?
The pandemic really told us that you need to build more resilient health systems. During the pandemic, in all the countries that we have good quality data, the excess mortality was very important for almost every cause, for communicable diseases, for non-communicable diseases, cancer, diabetes, you name it. Because during the peaks of transmission, the health systems were completely collapsed because the emergency rooms were overwhelmed with the COVID-19 cases, because the health centers were closed, because the people were not feeling comfortable to go to a health center, because the telemedicine and telehealth was already there, but it was very little using the reality. So I think that this was a very important message that we need to have more resilient health systems that can continue functioning and providing care for people during the crisis. But even in a regular period, the health system need to be more resilient in order to be able to reach people that now have some barriers to access the traditional way that the health systems are moving forward. So I think that building resilience is really crucial.
When you think about resilience and what core capabilities are, including digital tools, do countries need to build stronger systems? Do they have to change everything? Or you think they can just incrementally improve things?
I think that they need to renew and strengthen primary health care in a different way that was supposed 45 years ago in Alma-Ata. Alma-Ata was a revolution. At that time, it stated that health is not only hospitals, but primary health care is a very important part of the health system. It was a revolution. But when you see the declaration of Alma-Ata related to what was the epidemiological profile or the epidemiological scenario at that time, it is mostly focused on maternal and child health. It mentioned some endemic diseases, and that's it. Now, we think about the primary health care not only as the entry port of the health system, but being closer to the communities. Primary health care can provide and can deliver promotion, prevention, surveillance, fast response to outbreaks. Who will be the health service that you detect that something is different in an outbreak going on? Probably is the health center. So we are thinking about a primary health care that is adapted to the current days, that can use the technology that are available, telemedicine, telehealth, that can be better prepared to respond to non-communicable diseases, because we estimate that 34% of the deaths that we have in the Americas related to non-communicable diseases could be prevented if they could be diagnosed earlier and could be follow up in a better way than they really are. So I think that, of course, hospitals are very important to the system, but if we don't provide a more balanced system, having a primary health care with these characteristics, we will continue seeing lots of people that don't have proper access to health services.
It's interesting that you brought up primary care as one of the directions we really need to go in. You would think that would be a logical choice, and it hasn't been. And it's interesting that 2 of the last 3 speakers who we've had on the podcast have said basically the same thing, to have focus more on an incidence of primary care. I'm happy to hear that at the highest levels in healthcare in the Western Hemisphere, if not the world. Matter of fact, let's talk a little bit about PAHO.
The Pan American Health Organization was founded in 1902. So it makes us the oldest public health international organization in the world. When the WHO, the World Health Organization, was created in 1948, PAHO and WHO signed an agreement so that the PAHO also serves as regional office for the Americas, but keeping our autonomy, our independence, so we are a double organization. At the same time, we are the public health specialized agency that is part of the Inter-American system, and we also serve as WHO regional office for the Americas. We have a very strong country presence. Our headquarters is here in Washington, D.C., but we have country offices in almost every country in the region. And these country offices are not diplomatic representation. They have a technical team that work together with the Ministry of Health to advance the public health agenda in the region. And we also are very important to serve as a platform so countries can come together to address the main challenge that they have. We run the surveillance, regional surveillance system that is 24/7, looking for signals, things in social media, media vehicle that says words like outbreak, epidemic, fever, hemorrhagic fever, unknown disease, etc. And last year, just to tell you how this is important, we identified more than 1.2 million of these signals. And based on the verification process that we conducted, we performed after the detection with the Ministry of Health, we were able to identify 130 public health emergencies in the region from hantavirus outbreaks, fever, measles, and we work with the Ministry of Health to support the response. And the PAHO also, in this case, serves as a platform so the countries can come together in the region under this spirit that we call Pan-Americanism. So we can cross borders and can collaborate and can work together to protect the entire region and each one of the countries in the Western Hemisphere.
Do you see improvement in the countries working together in this aspect?
I think that you have a lot of good examples. In South America, for instance, that the countries, they have very common borders, that have cities that are almost one city on the border. So we have a lot of good experience responding to vector-borne diseases or how they can have mechanisms that the population will share health services, specialized health service for cancer, for dialysis and others. In America, they have a very strong coordination mechanism and that brings together the Ministry of Health and establish the agenda. In the Caribbean, we have CARICOM, so in CARFA, the Public Health Agency for the Caribbean. So I think that things are moving in the right direction. Of course, that it's not, you cannot take this for granted. I think that we need every day to tell the good stories, to share the good lessons, and that the diseases, we cannot respond to them if we think about isolated countries that will be prepared to do everything with no support. It's not feasible because collaboration is better. No, it's because this is the only way that we can respond properly to the challenge that you have nowadays.
How important are governance and public trust in building resilient health systems, and how can countries strengthen those?
This is very important. For governance is crucial because in several countries in the region, we have a fragmented health system. We have the network of services that belongs to the Ministry of Health. We have another one for the Social Security system that they have. In some countries, they have a specific subsystem for the military or for the public servants. So governance is crucial. If they don't bring it together, they establish a very, very strong mechanism of governance. The leadership of the Ministry of Health to identify the gaps, to channel the right resources to address these gaps will be limited. And trust is also very important. I think that when we are talking about primary health care, if the population, if they don't believe that going to a primary health care center, they will have their problem is solved, or this will be the best way to go to a specialized center if they need to go to one, they will not go to a primary health center. They will go to an emergency room, and they will be there in crowded emergency rooms because they know that after 4, 6, 8 hours they will receive some attention, they will get an X-ray, a laboratory test, etc. So the best way that we have to strengthen primary health care and to have a more efficient use of the limited resources that the countries have is if the primary health care has this trust from the population. that they know that they will find the care that they need there.
What advice do you have for a young person who's just now embarking or wanting to embark on a career in global health?
In Brazil, my country, for some years, I teach epidemiology in public health undergraduate course. If you are interested in global health, international health, I think that it is important to have some national experience because you can understand on the ground what's happening, how the things are working, what are the difficulties, but also to participate in forums, in discussions, that will bring something. And then let's not forget that there are some things now that also will be very important in the near future. The use of artificial intelligence. This is not the future. We are using artificial intelligence in prisons in Paraguay. Artificial intelligence embedded on mobile X-ray machines that go to a prison and perform a screening, and the face reading of the X-ray is made by artificial intelligence. So I think that's very important to understand the digital transformation, because clearly this applies to every field in public health, from epidemiology, surveillance, management, planning. So I think that is really important.
Dr. Barbosa da Silva, thank you so much for joining us today. Thank you for being such a big part of CUGH and coming to the meeting and being such a great role model for many of the people here. Thank you.
Thank you. Thank you. It's a real pleasure and honor to be here.
Follow us on Apple Podcasts or wherever you listen to podcasts to hear the latest episodes, and join our community that is dedicated to making a lasting positive impact on global health.